different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a physiotherapist talking to a patient called Martin Gregory. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Mr. Martin, what brings you here today?
Oh well, I had a reverse total shoulder arthroplasty surgery on my right shoulder 6 weeks ago, and I have a sling for the past 4 weeks. I've just been doing what the home health people tell me. I just can't lift anything. I have no shoulder hyperextension, and I just need to rehabilitate from that surgery.
So, you said that you can't lift things right now. How about what things does your shoulder keep you from doing that you'd like to do?
Well, pretty much anything is difficult. I can't hold anything that's heavier than a coffee cup, and I can't support my own body weight. I can't drive, and I can't really do many outdoor things like go fishing with my grandson and stuff. I also like to play catch with him. But I'm right-handed, and my shoulder hasn't allowed me to do that since I had my surgery. To be honest, I was having a tough time doing that beforehand.
Are there any other issues you face due to your shoulder, such as opening doors, or while navigating through your house?
Well, as long as I can do with my left shoulder, that's fine. But while doing anything, I just have kept my shoulder right here in the sling for most of the time. So I can't really do anything with that, like putting on a shirt, and things are hard when you have to brush your teeth left-handed. It's kind of weird, as you don't do it often.
Yeah, I understand, Mr. Martin. That's hard. Well, I know you've had the surgery. Have you had anything else in your past, like a medical history?
15 years ago I had a rotator cuff repair. I have played a lot of tennis in high school and in college, and I think doing all of that really put a lot of stress on my shoulder. So I had surgery on that, and then the past year, I have had increased pain, weakness and loss of range of motion in the shoulder here.
Now, I want to know more about your past. Do you drink?
I have a beer every once in a while.
Okay. How many times a week do you drink?
I just have a couple on Saturdays.
Okay. Do you smoke cigarettes?
I don't. I used to, but not anymore.
Okay, I'd also like to go through some other details, just to make sure everything else is fine. Have you had any history, or currently any problems with your heart?
I do have hypertension, but I take medication and that seems to take care of it.
What medications are you taking right now?
I'm taking 2 medications with some goofy names, NSAIDs and Tenormin.
Okay, those are anti-inflammatory drugs. How often you take them?
Well, I'm supposed to take NSAIDs, 1 a day for pain, and Tenormin, I think twice a day.
Do you live with your family?
Yes, with my wife Gretchen.
What is your occupation?
I was a school teacher for 28 years. So now, I mostly do stuff for leisure.
Okay, how much did you exercise before the surgery?
You know, I tried to get out, and we have a little dachshund, so I would get out and walk him every morning. I take him down to the high school, that's down from the house, and we do about a half mile on the track every day. It helps to kind of keep me limber.
Yeah, that's pretty good exercise. Now that you are moving a little bit, what do you think the pain is at right now, on a scale from 0 being no pain, 10 being the worst possible pain imaginable?
It kind of fluctuates. But, I would say most of the time, it's right around 4.
Okay, and does it ever get worse?
In the mornings, it's a little stiff, and that's probably the most painful. Sometimes, if I roll over in my sleep, and that doesn't feel very good.
Extract 2. Questions 13 to 24. You hear a dietitian talking to a patient called Naomi Myers. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello Naomi. How are you today?
I'm doing good. Thank you. How are you?
I'm great. Thank you for asking. My name is Aaron Kaminsky. I'm the registered dietitian here, and I understand that you were brought to me after a doctor's appointment that you've had. Is that correct?
Yes, it is.
All right. Do you mind explaining to me how that appointment got you here today?
Yeah, sure. I went to the doctor's last week and we had done some tests and found out that I have very high cholesterol, and so I have an appointment with you today, because I would like to weigh out some of my options as opposed to immediately going on medication.
Okay, great. So we'll just get started by asking a few questions. What do you generally do to start off your typical weekday?
Well, depending on what day the week it is, I wake up between 6:30 and 7:30 in the morning. First thing I do is take a shower, brush my teeth, make a pot of coffee, get dressed, and usually after that I start my workday.
All right, and what do you do for a living?
I have 3 jobs. On Mondays and Tuesdays, I do toxicology at County Medical Examiner's office for postmortem there. The rest of the week, I work as a lab technician at Belmont's Hospital. After an 8-hour shift each day, I go straight to Ruby in downtown, where I work as a bartender and a server.
Wow. So you definitely are keeping busy throughout the week. Do you think during all these busy work hours you had time for meals?
I do. I don't eat breakfast. It usually doesn't make me feel too well. I have my coffee as my breakfast. There's a lot of fast food places that I go to in between going to jobs or on my lunch break, like Taco Bell, Burger King. There's also a Subway next to one of my jobs. Usually when I get home from work, especially if I'm at Ruby, I'm always really hungry. So I'll grab some ice cream from Friendly's.
Okay, and on a scale of 1 to 10, 10 being the most stressful, do you find yourself stressed working all these hours?
I would say, on a scale of 1 to 10, definitely close to a 10, around a 9.
Okay. So, you're stressed out, and do you think that has effect on your eating habits?
Having ice cream after a long day definitely makes me feel better at the end of the day. But I don't think the stress has too much influence on my diet.
Okay, all right. So, do you live with anyone at home?
I am currently living with my boyfriend.
All right. Is there any type of exercise going on throughout all these busy days of yours?
I used to run on the treadmill before I accumulated all my jobs, but now I don't really find the time.
All right. Does anyone in your family have high cholesterol as well?
My dad is on medication for high cholesterol, and a lot of his siblings have high cholesterol.
So, it's kind of in the family?
Oh yes.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a doctor briefing his colleague about a patient. Now read the question.
Have you got a list of all the patients and locations?
Yeah. Who is our sickest patient?
Mr. Marcel is the sickest patient. He is a 36-year-old male with a ruptured appendix awaiting OR. He became sick over the last 48 hours with worsening abdominal pain, nausea and vomiting. We gave him fluids and brought antibiotics.
Which antibiotics and how much fluid?
Piptazo with 2 liters of normal saline so far. Imaging showed a ruptured appendix with free air under the diaphragm. I would keep a close eye on him.
Have you drawn blood cultures?
Yes. But they were drawn about an hour after antibiotics were started.
And what are the plans if there is a delay in surgery?
I haven't spoken to ICU yet, but he might need to go there if his condition worsens while he is waiting for the OR. Sound good?
Yeah, I'll speak to ICU as soon as we're done here.
Question 26. You hear part of a surgical team's briefing. Now read the question.
She currently only has intermittent late decelerations, and these have improved with her position changes and supplemental oxygen. We'll monitor her until she's fully dilated and allow her to push.
If there's any evidence of fetal distress or persistent late decelerations, we should be prepared to go to C-section.
I've alerted the OR to be prepared in case we need to use them.
Great, I'll discuss this plan with Mrs. Aldrich, and we are done here. What are her vitals right now?
Normal. I just checked 15 minutes ago. She had no late decelerations since you were called.
Let's continue to monitor her. I need to know when she's complete and pushing so we can keep a close eye on her second stage.
Question 27. You hear a radiologist talking about a new initiative that has been introduced. Now read the question.
This is a big, ambitious project. We're going to focus on patient flow through the system right from the very start. When a patient sees their commission and they require support from radiology with imaging and they make a request, we want to get that request from imaging as quickly and as efficiently through the system to the reports available to the commission, so they can make the appropriate management plan and take the patient's clinical journey forwards. This is an ideal opportunity now to really embed some forward behavior, where we're learning together, we're developing together, we're looking at creating where we have today's work completed today, that there's no delay, so we're really improving the services to our patients. We are all taking control, we are all involved, and we will be proactive and not reactive, so we have analyzed CT and MRI services. We have outlined and prioritized areas for further improvement, and you can make a difference.
Question 28. You hear a pharmacist talking to a doctor regarding a patient's medication. Now read the question.
Hi, Dr. Marcy, is this a good time? I need 2 minutes to discuss about Mrs. Samuel. I'm Harper and I'm providing pharmacy coverage to the unit.
I have a few minutes. What's up?
Nursing raised a concern from rounds this morning. The situation is that Mrs. Samuel's pain isn't being well controlled. She's sedated, which is having an impact on her participation in therapies, and she's continually reporting her pain at 8 out of 10.
Okay. What's the background of the patient?
She has fallen 3 times since her admission to rehab, and she's requesting to go home at her first pass this weekend, some big family anniversary. But my assessment is that we are not adequately controlling her pain, and what we're giving her is contributing to these falls.
Okay, so what do you recommend?
Well, after reviewing her chart, I'm considering lowering her dose of opiates and introducing an anti-inflammatory which would be less sedating and she should be able to tolerate.
Yeah, that makes sense.
Her husband is coming in this Tuesday at 9 a.m. If you're available, we could meet to discuss.
Okay, sounds like a good plan. Let's meet back here and we'll talk to the family together.
Now look at question 29. You hear an optometrist talking to a patient. Now read the question.
Mrs. Wilfred, what brings you here today?
I am having trouble with my vision. I can't see and I need new contacts.
Okay, are you having trouble seeing up close or far away?
I can't see anything. I'm night blind and my eye is very itchy now. I brought my glasses with me and I want you to check them.
Okay, let me check your glasses. I will show you some lenses and just tell me if one of these lenses makes these letters look better.
These aren't working.
Okay, now I'm going to check the health of your eyes. It looks like you have a detached retina and contacts will not help in this situation. You need a surgery.
Can I get glasses instead?
No, ma'am, the problem that you are having now will not improve by using glasses.
Can you give me some drops for few months?
No, ma'am, drops will not help with your detached retina.
Question 30. You hear a podiatrist talking about a proposal to offer help with dialysis patients' foot care. Now read the question.
For the last couple of years, we were aware that a lot of the patients who underwent dialysis were at really high risk of developing complications with their feet, especially the diabetic patients. We found that a lot of them were struggling to attend our clinics and access the service. We had to come up with an ingenuity project to try and improve an element of care, and we thought this was a brilliant opportunity to look at the problem that we already identified and see if we could come up with a solution for it. So, we are offering our service to the people who would find it difficult to access our service. It would be really nice as we're making a difference to their life because they don't have to go out on their day off, and they go out 3 mornings a week, and when it's freezing cold.
Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You hear a veterinarian called Dr. Han Philip giving a presentation. You now have 90 seconds to read questions 31 to 36.
Hi, I'm Dr. Han Philip. First of all, thank you everyone for coming here tonight. Dogs can have a variety of back or spinal diseases and injuries. Slipped or protruding discs are very well known in longer back breeds of dogs like Dachshunds for example. But, a disease you may not have heard of can be very devastating, and I have an interesting case to show you. The disease is called Wobbler's syndrome. Tucker is a 3-year-old rescued dog, who is very loved by his adoptive family. He is a Great Dane, but because he's adopted from a rescue, the family did not know anything about his medical history or breeding. However, at about 8 months after coming home, Tucker began showing some very subtle signs of lack of coordination and slipping on tile floors. Then one evening in normal play, he yelped out with severe pain in his neck. The next day, routine X-rays of the neck revealed a suspicion of a cervical malformation in the last 3 neck vertebrae. He was sent to a specialist in neurology for an exam and even an MRI, exactly as we have in human hospitals. It was done under a general anesthetic. The MRI shows very clearly 3 cervical vertebrae that are thickening and pressing inward on the spinal cord. This is called spinal stenosis, and it will cause slow progression of weakness and therefore the name Wobbler's syndrome, and eventually it will cause paralysis and, unfortunately, early euthanasia. It is an unfortunate and sad disease seen in many breeds, especially common in Doberman and Great Dane. The first signs are usually seen at 4 to 6 years of age in Dobermans, but much younger in Great Danes. The owners typically see their dog become wobbly or uncoordinated. You may hear of cures such as feeding low-calcium diet and acupuncture. But, none of these things have been proven to be of real benefit. Some Wobbler's dogs can be managed on steroids and restricted activity, but the only real cure is a spine surgery called modified dorsal laminectomy. It is a surgical procedure of the spine, which aims to provide access to a prolapsed disc and therefore relieve pressure on the spinal cord. This surgery can take place only once the location of the trouble spot is known. This procedure is also used for dogs with severe neurological damage to the hind limbs, bladder, or bowel, as a result of spinal cord compression. Dr. Larry Newman, a board-certified specialist and neurosurgeon in private practice at the Veterinary Referral Center, did this surgery on Tucker. It is an extremely delicate and precise operation. Special instruments are used to remove the tops of the affected vertebrae, which then decompress the spinal cord and allow it to function without the damaging pressure that will eventually cause pain and paralysis. Immediately after surgery, it is important the dog has strict rest for a period of weeks, to allow swelling and inflammation to subside. The dog requires appropriate pain relief, and for those with impaired limb or bladder or bowel function. Nursing care is essential to prevent bed sores or urine scald. In the intermediate term, physiotherapy such as hydrotherapy, massage, and passive movement exercises can help to maintain muscle tone and aid recovery. This allows the muscle to reattach to the operative area. Today, Tucker is recovered and a happy, healthy dog, who will live a normal life without worries of pain or paralysis. The cost of diagnostic scans is significant, at around $800 to $2,000. The surgical expertise and equipment needed means this is an expensive procedure, and you should expect to pay anywhere between $1,500 and $6,000. It should also be borne in mind the dog may need intensive care for a few days following surgery, which costs around $600 per night. Since the Tucker's owners had purchased pet insurance, the company paid 90% of the total cost and is a perfect example of how pet health insurance really pays. Tucker's owners caught these symptoms early, and it was really helpful for both the veterinarian and the specialists to work together for a perfect outcome. This also demonstrates how early detection of any problem and the help of the whole veterinary care team is so important for the precise treatment and complete cure. Where there is a recognized predisposition to disc disease, such as in the Dachshund, the owner should avoid activities which place strain on the back. In addition, at the first indication of back pain, the dog should be strictly rested and given pain relief. Dogs that show signs of numbness on the back end, such as staggering, weakness, or poor coordination, should be rested and see a vet as soon as possible in order to receive appropriate therapy and limit damage.
Extract 2. Questions 37 to 42. You hear an ophthalmologist called Dr. Ralph Peterson giving a presentation. You now have 90 seconds to read questions 37 to 42.
Hello, everyone. My name is Dr. Ralph Peterson. I'm an ophthalmologist and a specialist in photochemistry. I will be talking about the genetic model and how does it fit in optometry. Well, genetics is being incorporated into medical care in terms of dealing with disease and specifically in one of the really critical areas of pre-symptomatic evaluation, or in other words, it's being able to intervene before the symptoms. The advantage of that, of course, is that you delay the onset of the disease and then, when it once manifests, you can delay the progression hopefully, and also decrease the severity, and things like that. So, this is already being done and interestingly ocular disease represents really a better sort of venue, so to speak, than systemic disease, because there are a whole bunch of ocular diseases that result from a single mutation in one codon. Lots of these systemic diseases like heart disease, hypertension, diabetes and other things, the genetic contribution is very complex. There are multiple genes and multiple sites, and there are all sorts of complications and complexities in terms of applying that to actual clinical care. Even though it will be done, but it will take a longer period of time. There are all these studies going on like the 1000 Genomes Project. The genomics is already being applied in terms of ocular disease. I read a paper where they were looking at mutations in rhodopsin. If the mutation occurs in that area, it tremendously affects how rhodopsin responds to light. It does so because the rhodopsin to respond abnormally and it does result in disease. But it's not quite as drastic as in the first sign. We were able to show this with standard measurements that one would do in a clinical setting such as visual acuity, visual field diameter, dark at that sensitivity, ERG amplitude. But, it's not something that optometry is identified with. There are two categories. The first category is genetic testing, useful in terms of the things that I mentioned. I think the second issue is in terms of optometrists dealing with ocular disease. The public recognizes optometrists as being viable health care providers in terms of ocular disease, and I feel now this entire thing could be in jeopardy if optometrists don't get involved with genetics. When someone presented with some sort of ocular disease, we are already at the 5-year point. It's not a question of if this happens, it's a question of when it's going to happen. Okay, I have no idea when it's going, but it's going to happen and optometrists are completely unprepared for this. So what does that mean? Let's say some point, that's what the ophthalmologists start to do. In other words, you go in for an exam for an ocular disease and they will draw blood and send it out for genetic analysis, and optometrists aren't doing this. So in terms of the public perception, what does that mean? So in my mind, it's sort of analogous to, let's say you going to your internist for your yearly checkup and the person not drawing blood, to do, let's say a lipid profile, so who's going to continue to go to such a person? Most of the ophthalmologists are doing genetic testing and helping patients with that. In fact, I think just about everybody involved in ocular disease in the ophthalmology community is doing this as part of standard care routine. As I said, there are a few optometrists here and there who are doing it. But, it's not something that is recognized universally in optometry and, more importantly, as I said, we're not training students to get involved in this area. In terms of the mundane aspects, including insurance, I think there are three things in general that are happening, that are pushing genetic testing more and more into clinical care, ocular as well as otherwise. One is that the amount of money it costs to do the analysis is coming way down. The second thing is the length of time it takes to do an analysis is speeding up very significantly, and perhaps most importantly, the insurance companies are starting to cover the tab because they are beginning to realize that it will cost them less in the long run. So these are all important issues that are driving genetic testing into a standard medical care. Now, both nutrition and genetics are becoming part of issues that are important in terms of ocular disease and specifically in age-related macular degeneration. So, one of the things that has happened just over the last couple of years is some models have been set up which look at a bunch of different factors, including genetics, environmental, diet, nutrition, demographic and ocular factors that can predict how likely it is that someone is going to develop AMD and once it develops what the likely progression characteristics are going to be. But again, showing you how both these areas are becoming vital in terms of dealing with ocular disease concludes it. That is the end of Part C. You now have 2 minutes to check your answers. That is the end of the listening test.